Yeah. So this is your card, and view full screen. Yeah. So
Mhm.
this is the first card.
Yes.
So atrial fibrillation. Yeah. So this is your card. Yeah, you can prepare, and once you are ready, you can start. Yes, Dr. Sholeh Toobaei.
Yes, sir.
Yes, you can start now.
How can I address you, please?
You
Sorry.
can call me Lincoln. My name is Abraham Lincoln.
Okay, Abraham. Um, Good afternoon, Mr. Abraham.
G-
I am. Good afternoon. I
Good
am Dr.
afternoon, doctor.
I am Dr. Sholeh, who is working in this hospital and who is responsible for your father, Mr. Smith. How can I help you today?
Yes, you can. Yeah, my father, Harry, is
Mm-hmm.
a little bit disturbed. I don't know what to do exactly. You know, my father, Harry, he is 68 years old, and
Mm-hmm.
I am little bit worried about his health. You know, doctor, yesterday, yeah, he actually, my father had a fall 2 days
Mm-hmm.
ago at home, and now has extensive bruising and pain on
Mm-hmm.
his right thigh, but otherwise he's well.
Mm-hmm.
Of course, what happened yesterday is my
Mm-hmm.
sister gave Harry a couple of her own Panadine 40 tablets, and
Uh-huh.
it significantly relieved his pain. And I feel so that's good for him. So I came here to collect some prescription for
Mm-hmm.
Harry, who is in too much pain and he's not able to walk all by himself to the clinic today.
Understand. I am so sorry about what happened to your father, and also I am sorry for pain. As you mentioned, he had fall and he had some bruising, and you gave him medicine. But unfortunately, I cannot write the medicine without seeing the patient and assess the patient. Especially this Panadine, Panadine Forte for him.
What's wrong with you, doctor? Why you know him? Why do you want to see him? You have been seeing him for many months, maybe years now, and still you want to see him? I don't think that is needed, right? I demand an explanation. Why are you not giving me the prescription?
Yes, you are completely right. I know your father very well. But the thing is that this condition is new for him, and I have to assess him to check for this new condition. And since he's taking warfarin, and this is a very serious medicine, and Panadine might have some reaction and some a cross reaction with warfarin. So I have to see him and assess the degree of injury, and I have to know that it might be some other reason for bruising, and I have to rule out the other reason for bruising besides falling down. That's why I have to assess him.
Yes, doctor. Of course, I can understand what you're telling, but the thing is, I don't think it is necessary again.
Mhm.
So, if yeah, I'm little bit worried about my father and his health. I can't bring him. Now, what am I supposed to do? I don't understand. I'm getting upset and worried. Why don't you give me this medication?
I completely understand your concern, and uh, um, I think maybe it must be very difficult for you and your father, and see your father in pain. But I can arrange some home visit to see him and assess him in at home if he can sign a consent for going home. Is that okay for you?
I don't think that is a fine what you are doing, and I don't think that's needed for now because yeah, right. Wasting
Um,
your time and coming to my house, and you know, I don't think that's much is needed. Okay, so
oh,
isn't there some other solution for this? Why are you sticking on to coming to the house?
Mr. Smith, your father well-being is the most important thing for me. So I have to be sure about his condition. And don't worry about that. I can arrange the meeting. It is not difficult for us. It's my duty to take care of your father. And I can arrange the meeting. It's very easy for me. And as I mentioned before, your safety, your father's safety is very important for me. So I can arrange the meeting and I can see him at home, and then I should consult with another doctor about prescription of this medicine. As I told you before, it might have some cross reaction with warfarin, which he's taking now. Is that fine with you now?
Yeah, of course, I can understand. Maybe you are right. I genuinely think that it is not important, but you know better. Maybe I have to listen to you. Okay, so what is your solution now? Because he himself cannot come, and it's difficult for him to bring him here. So, fine, if you are ready to go take a second mile, okay, and then go a second mile for my father, I'll be very much thankful to you. But is that really necessary?
Yes, I think it's very necessary for making a decision regarding taking this medicine or management of pain, and also his assessment of his condition. It's very necessary and obligatory to visit him even at home. And if you have any other concern in between, you can call me, and I will
Oh, sorry. Yeah, yeah, unmute, please. Sholeh. Yeah,
hello, yes.
continue. Sorry for that. Mm.
Okay, as I mentioned before, your father's health is very important for me, and for in order to make a good decision, I have to evaluate his condition and also assess him very well. So then I can make I can do management and treatment for him, and even at home, it's very easy. Your father is not the only patient that has this problem, and we had many other patients same as that, same as him, and we arrange the meeting and we take care of that. Now, what is your idea? Are you fine with?
Yes, thank you very much, doctor. That was very nice of you. Your extended support and the concern to my father. I really appreciate your care and concern. Thanks once again, doctor.
Thank you so much. And if you, in between, if you have any problem and something happened to your father, please be in touch with me. Thank you so much.
Welcome, doctor. Thank you once again. Yeah. So, Now let me give you the feedback. Yeah,
Mm-hmm.
Sholeh. Sholeh, I really like your second half. I
Mm-hmm.
really like your second half, not the first half, because in the first half you panicked, you were a little confused, you did not know. There were a lot of pauses and there were a lot of breaks, and you were waiting to think about what should I speak in the next sentence, and there was some hesitation and chaos, unnecessary sounds and all. The delay in sentence production. For the next sentence, there was a beginning problem, you have a starting problem. Every sentence in the beginning, you had a problem, especially in the first half. And I did not expect that, but still, it happened. So I have to tell you, I have to give you a caution, I have to give you a hint. You have to take care in the beginning. In the beginning, you have to control yourself, you have to be confident. I don't know how you regained your confidence in the second half. I was really shocked, you actually, the thing is, you have extremely high level of confidence, extremely high level of confidence you have. So, and a lot of experience you have, you can definitely do well, no doubt regarding that. And you can create your own sentences. The more you practice, the better it will be for you. So try to practice on a regular basis. And then
Okay.
yeah, you recovered in the second half. There was panic and confusion. The idea generation, that means the plot construction. What should I speak next? What should I speak next? Actually, you have no need to worry or panic regarding this. But still, I don't know, because it was online and it was with me. Maybe it was after some days, after many days, you come online. So that maybe because of all these aspects, you had that little, a wavery attitude in the beginning. But afterwards, anyhow, I think in the next session you'll be doing very fine, and no doubt. Now, coming to the point, your fluency was hindered in the beginning, but slowly you recovered and came back to normal. It was not 100%, but you recovered 80 to 85%, I can say. And then the fluency, the pronunciation was fine, there is no problem, but some words like you're saying bruisey, it's bruise. Okay.
Bruce.
Yeah, you can listen to the Cambridge pronunciation. You can go to Cambridge Dictionary, you can write the word and you can press the sound, and it will tell you very clearly how you have to pronounce the word. So I think you know how to use Cambridge Dictionary. That's good for you. Do you
Yes.
know that? I
Yes,
think
I
I
know
have
that.
shown you, right? Already in the classes.
Yes,
Okay.
I
Yeah, that's
yes.
fine. That's fine. And secondly, grammar. Yeah, you don't have any problem with grammar. Okay, you are using mega sentences, you are using medium range sentences, you are using small sentences or ordinary sentences also. There's no problem. You're fluctuating between different sides or types of sentences. That's no problem. Sometimes you can use ordinary sentences, sometimes you can use complex compound sentences. That doesn't matter. Only the flow is maintained. That's very important. And then next, vocabulary. Yeah, vocabulary you can refer. I heard some words which you have used. Very nice words. I don't recall those words immediately now, but you have definitely used extremely mandatory is one word. Yeah, mandatory. And along with mandatory, you used another word, complicated or something. I don't exactly remember. Mandatory. Immediately before or after, you used another word. So I was little surprised the way how you use the word mandatory, means it's an order like. Okay, so now I can tell you some plan how to generate your sentences. But okay, then pronunciation is fine, grammar is fine, vocabulary is good, and then your fluency, accuracy. Yeah, regarding accuracy, there is some mistakes. There is some problem with pronunciation and sentence, sorry, grammar, but that's not very serious problem. Now let me tell you how you have to generate your sentences.
Mhm.
For somebody is telling you no, why do you want to ask him to come here? He cannot come here. So then your response is like this: as a responsible doctor in the first place,
Mm-hmm.
I have to follow the rules and regulations provided by the medical council as well as the present hospital in which I am working. There are some ethical code of conduct that we have to follow very seriously. Based
Mm-hmm.
on all these guidelines, I can tell you very clearly this is ruled out. Without without seeing your father in person, I cannot give you any prescription that is against the code of ethics, and
Yes.
um, it is indirectly against the norms. Your father's health is my responsibility, and I cannot waver from my responsibility. Just I cannot avoid myself from shouldering the responsibility. What if something goes wrong and your father has to face serious complications because of some side effects, some other medications which you are taking, for example warfarin. This warfarin may affect may you know uh, intervene or get in it may
Interact.
affect, yeah, it may interact in a negative way and produce negative results. Yeah, fine. So there may be some serious complications which I do not want to happen in your father's present situation. Why don't we avoid such unforeseen problems? So it's
Mm-hmm.
better, prevention is better than cure. Taking
Yes.
one more step, either your father comes here or I come to visit your father, that doesn't matter. Only the health of your father matters me the most.
Mm, matters
So
me
the
the
way
most.
how you are, the way how, yeah, you have used many good sentences, no doubt regarding that. That's very good. Actually, your speaking was, if I tell you, it was a B plus actually, but because of some hesitation and other things, the second half is B plus, but first half is just a C. I'm sorry,
Uh-huh.
I have to be frank enough. First half was just a C, but second half you have risen to the heights. You have got B plus in the second half. So average it can be C plus.
Mm-hmm.
Okay,
Yes.
maybe 340, 350, 360, around about that. I can tell you, minimum 340 you will get there.
Mm-hmm.
So you have improved in the last stage. Why don't you start from the beginning itself? Is that clear?
Yes, yes, you are right.
Yeah, now your speaking session. Now tell me, what do you feel about this feedback that I have given you? Are you happy with that? Or are you
Yes,
upset because I gave you too many corrections? I said it's not very excellent. I have to tell you frankly because you are my student. I value your quality. Yeah, tell me.
yes,
You have
yes.
30 seconds to 1 minute.
Absolutely. I am happy with your feedback, and I appreciate your I can say criticism or something negative feedback because I have to.
Constructive criticism. It's not
Yes,
negative feedback. Negative feedback is destructive criticism. Destructive criticism means if you speak like this, you will not pass in the OET. You will
Mhm.
get only two. This is negative feedback. That
Yes,
is
you are
destructive feedback. I'm not telling destructive. It is constructive feedback.
right. Yes,
Everything is good, but these are the areas which you have to improve. That is what I'm telling. I'm not saying
yes.
you cannot improve, but I can saying you can improve if you. So this is
Yes.
constructive criticism. Yeah, you are right. Come on, go ahead.
I appreciate your constructive feedback because I have to work out. I don't expect you to say me that you are fine and no need to work. I have to practice more and more, and I have to know my weak point. Otherwise, I don't know how to how which part I have to work more. Thank you so much.
Right, that's very good. That's very good. So you have time means you can go for another speaking session. You can prepare. In the meantime, I'll say check if Keval and Mursi. Well, how much time is left for you, Sholeh?
I have half an hour.
Okay,
Half
you
an,
prepare for the next card. Then in the
oh,
meantime, I will take for
thank you
Keval
so much.
or May Mursi. Keval, are you ready for a speaking session? Mursi, are you ready for a speaking session? Let me know. Yeah. Sir, after Mursi, if she is ready. Okay, Mursi, are you ready? Unmute Mursi. Do you want to do a speaking
Yes.
session?
Really, I want to listen more to improve
Okay, no
myself.
problem. Yeah, yeah, yeah. No worries, no worries. However, you are comfortable. That's a good way of learning from others. Okay.
Okay, thank you.
Okay, fine, fine. Yeah, Keval, you can prepare. Next, I'll take for you after Sholeh. Okay, Sholeh will take the next speaking card. And after Sholeh, so yeah, number one. So Sholeh, Toobaei, that is done. Number two is also Sholeh, Toobaei. Yeah, number three is Keval Shah. Okay. Number four is also Keval Shah. If anybody comes in between, I'll give you a break, Keval. Yeah. Um, number two, Sholeh.